Hello friends, the topic of this video is rectus sheath. Often a short note is asked on rectus sheath and the answer should be written under the following headings: Introduction, Formation of the rectus sheath, Contents of the rectus sheath and the relevant applied aspects. Now before I start with the rectus sheath, let us first look at the rectus abdominis muscle, its origin and insertion. So rectus abdominis muscle is one of the four muscles of anterior abdominal wall, and its origin is from the pubic bone, that is from the pubic symphysis, which we can see here, and the pubic crest. It is inserted above onto the xiphoid process of the sternum and onto the costal cartilages of fifth, sixth and seventh ribs, right? So it is known as rectus. Rectus means straight. So you can see here this muscle is straight and is present on either side of the median plane in the anterior abdominal wall. Let us now look at the muscles involved in formation of rectus sheath. Now here we can see rectus sheath here also and below also. It has been cut to show you the muscles that will be involved in formation of this rectus sheath. You can see this is white in color and this is formed by aponeurosis of the other three muscles. I told you there are four main muscles which are present in the anterior abdominal wall. One of them is the rectus abdominis and the other three, their aponeurosis, they are going to form this rectus sheath. So here we can see this is the rectus abdominis muscle. Sometimes there is a fifth muscle also, and that is small muscle which is present anterior to the lower part of the rectus abdominis, and this muscle is known as pyramidalis. If it is present, this is also enclosed in the rectus sheath. Now let us look at the three other muscles which will be involved in the formation of rectus sheath. Superficial most is the external oblique. So you can see here external oblique, and as it approaches the rectus abdominis muscle, you can see it is becoming aponeurotic, and these aponeurotic fibers, they are reaching the midline here. Next, deep to the external oblique, we have the internal oblique muscle. Similarly, here also you can see as it approaches the rectus abdominis muscle, the muscle is becoming aponeurotic and it has been cut here. This will also reach the midline. Its aponeurosis will also reach the midline. The deepest of them all is the transversus abdominis. You can see here, and we can see here again it is becoming aponeurotic as it reaches the rectus abdominis. Now aponeurosis of these three muscles, that is external oblique, internal oblique and transversus abdominis, they will be involved in formation of rectus sheath. When we say sheath, that means it will be enclosed in that. So some of the aponeurosis, they are going to pass anterior to the rectus abdominis and some of them are going to pass deep to the rectus abdominis. Now let us look at two more lines which can be seen here. In the midline we can see here, this is known as linea alba. Alba means white. So how is this formed, linea alba? This is formed by interlacing fibers of the aponeurosis of the three muscles from both the sides. So aponeurosis from this side, these fibers will also reach here, and from here also of all those three muscles they will reach here and they will interlace here, and that leads to the formation of linea alba. It is avascular area. This area is avascular here. The second line which you see here, this is a curved line which you can see here. This is the curved line. This actually extends from the tip of the ninth costal cartilage till the pubic tubercle. This is known as linea semilunaris, right? And this is the area where the rectus sheath is going to begin. Rectus sheath, we can see here the rectus sheath has been opened up to show the rectus abdominis, and here the muscle has been also removed to show you the posterior wall of the rectus sheath. Now let us look at the location of the rectus sheath, what exactly it is, its walls and the margins. So rectus sheath is located on either side of the linea alba. So this is the linea alba, and because rectus abdominis muscle is present on either side of the linea alba, obviously that's why the rectus sheath is also located on either side of the linea alba enclosing rectus abdominis muscle. So what exactly is rectus sheath? It is an aponeurotic envelope for rectus abdominis and pyramidalis muscles, right? And then this sheath has got anterior wall which has been removed from here, and it has got a posterior wall which can be seen here. So this is the posterior wall, and you can see the cut margins of the anterior wall, right? So that can be seen here. It has got two margins. The medial margin is formed by the linea alba and the lateral margin is formed by linea semilunaris. So anterior wall we will see later on, which has been cut here. This is complete. So it completely encloses the rectus abdominis and if present the pyramidalis muscle also, but its thickness is going to vary. It is going to be thin above, it will become thicker in the middle, and it is thickest in the lower part. Whereas if we look at the posterior wall, which can be seen here, this is deficient in the upper part as well as in the lower part. It is present only in the middle part. What is the function of the rectus sheath? It strengthens the anterior abdominal wall and it also prevents the bowstringing of the rectus abdominis muscle when it is used for flexion of the trunk. Let us have a look at the cross section of the abdomen so that we understand the arrangement of the muscles in the anterolateral abdominal wall, where exactly the muscular part is present and the aponeurotic part, and how it forms the rectus sheath around the rectus abdominis muscle. So if we take a cross section from the middle of the abdomen, it will look something like this. So this will be the posterior aspect, this is the anterior aspect. Here we can see the rectus abdominis muscle enclosed in the rectus sheath. Now if we look at the anterolateral abdominal wall, we can see the layers from outside to inside. Forming that will be skin. We have then superficial fascia, yellow in color. We don't have deep fascia in the anterior abdominal wall. And then we have the three layers of muscles, and these are the external oblique, the internal oblique, and the transversus abdominis. Still deep to that, this blue line which you see here, that represents the fascia transversalis. Still deep to that would be the parietal layer of the peritoneum, and then we will have the abdominal contents. Now to understand the formation of rectus sheath, I'll show you only this part, that is the anterior part of this cross section, that is the part which is present in front of this dotted line. So next few slides I'll be showing you this part only and we'll understand how the rectus sheath is formed. Let us consider the formation of rectus sheath. As I said earlier, the rectus sheath, its anterior and posterior wall, they are not same throughout the extent of the rectus sheath. So they keep on changing from above downwards. So that's why we will consider the formation of rectus sheath at three different levels: in the upper part, middle part, and the lower part. In this picture, we are showing you the formation of rectus sheath in the region above the costal margin. So here we will find that there is only anterior wall of the rectus sheath is present, the posterior wall is deficient. Let us look at this picture and understand how. So here we can see this is the rectus abdominis. These are the rectus abdominis muscle here, and they are resting directly on the 5th, 6th and 7th costal cartilages from where they take origin. Now, if we look at the anterior wall of the rectus sheath, which is formed here by this green structure, that is nothing but aponeurosis of external oblique muscle, which is present here. Outside that, obviously, will be superficial fascia and skin. But the sheath is formed by aponeurosis of external oblique. Here we cannot see the aponeurosis of internal oblique and transversus abdominis muscle. Why is it so? Because internal oblique muscle, that takes origin from the costal margin, and the transversus abdominis muscle, that takes origin from inner aspects of the lower ribs, right? So that's why they are not participating in formation of either anterior or the posterior sheath here. The rectus abdominis directly rests on 5th, 6th and 7th ribs. So this is important. In the region above the costal margin, only anterior wall is present, posterior wall is deficient, and anterior wall is formed by aponeurosis of external oblique. And that's why the rectus sheath, its anterior wall, is thinnest in this region. Next, let us look at the formation of the rectus sheath in the region from costal margin to midway between umbilicus and pubic symphysis. So that is to a point which will be between umbilicus and the pubic symphysis, right? So this is the middle part. Let us see here how the rectus sheath is formed. So we have here both anterior wall as well as the posterior wall. Again, if we look at the layers of the anterior abdominal wall, you can see here skin, superficial fascia, external oblique muscle, internal oblique, transversus abdominis, fascia transversalis, and finally we will have the parietal peritoneum and then the abdomen here. Let us look at the anterior wall now. Here we can see the aponeurosis of the external oblique is forming, right? And then if we look at the internal oblique, it's aponeurosis that splits. So some of the fibers, they will go anterior to the rectus sheath, and another layer of this aponeurosis will go behind the rectus abdominis muscle. So here then when we look at the transversus abdominis muscle, its aponeurosis is going behind the rectus abdominis muscle, and all these aponeuroses, they are interlacing at the linea aspera. This will be the region of linea semilunaris. So here the anterior wall will be formed by aponeurosis of external oblique muscle and the anterior lamella of aponeurosis of internal oblique muscle. Whereas the posterior wall will be formed by the posterior lamella of the aponeurosis of internal oblique and the aponeurosis of transversus abdominis muscle. Coming to the last, the lower part, right, of the rectus sheath, that is in the region between the midpoint of umbilicus and pubic symphysis, that is the point which we said where the second part ends, right, till the pubic symphysis. So let us see here. Again, if we see here, only anterior wall is present. Posterior wall is deficient here. So these layers we already understand: the skin, the superficial fascia, external oblique, internal oblique, transversus abdominis, fascia transversalis, and parietal peritoneum. Now let us look at the anterior wall. Now what happens here? The aponeurosis of all the three muscles, that is external oblique, internal, and transversus abdominis, they go all in front or anterior to the rectus abdominis muscle and interlace here in the linea alba. What about the posterior wall? There is no aponeurosis there. The rectus abdominis muscle now in this region is directly resting on fascia transversalis. So the posterior wall is deficient and anterior wall is formed by aponeurosis of all the three muscles: external oblique, internal oblique, and transversus abdominis. Now this transition in the rectus sheath, this takes place here. You can see this point here, that is the midpoint between the umbilicus and the pubic symphysis, right? This is the point of beginning of the third region which we saw here, and you can see a curved margin here which is known as arcuate line, which is concave downwards, right? So this is, what is this arcuate line? It is a concentric shaped structure or a fibrous line that marks the inferior limit of the posterior wall of the rectus sheath. So that ends here. You can see here, this is the posterior wall of the rectus sheath here, and below that this green structure which you see is nothing but fascia transversalis. Now if we see in a vertical, that is in a sagittal section, then how the anterior and posterior walls look. So again we will divide it into three parts: above the costal margin, then from the costal margin till a point midway between umbilicus and pubic symphysis, and from this point till the pubic symphysis. This will be the third part. Let us first consider the anterior wall. So here in above the costal margin, you can see this green color. So let us look at the layers here first. This will be skin, the black color line, then this color, light yellowish color, that is the superficial fascia. Then green color line is the aponeurosis of external oblique. Then orange color is the aponeurosis of internal oblique, anterior lamella and the posterior lamella. And then we have this purple color line which you can see, this is the aponeurosis of transversus abdominis, right? And after that, this blue color is the fascia transversalis, and this mauve color is the parietal peritoneum. So let us start from anterior wall here. So if we look at the anterior wall of the rectus abdominis muscle, this is rectus abdominis muscle, and what do we see here? Only the aponeurosis, green color, aponeurosis of external oblique is present in the anterior wall. What about the posterior wall? It is directly resting on the 5th, 6th, 7th costal cartilages, so it is deficient. Coming to the middle part here, the anterior wall we can see here is formed by this green line, that is the aponeurosis of external oblique, orange, that is the anterior lamella of the aponeurosis of internal oblique. What about the posterior wall? The posterior wall of the rectus sheath is formed by posterior lamella of the aponeurosis of internal oblique, orange color, and this purple color, this is the aponeurosis of transversus abdominis. So actually only in this region we have a proper rectus sheath with its anterior wall and the posterior wall. Coming to the third part, here you can see the aponeurosis of all the three muscles, external, internal, and the transversus abdominis. They are forming the anterior wall of rectus sheath. Posterior wall, you can see it is deficient, there is nothing there, and we can see it is resting on the fascia transversalis. Now you can see here this arcuate line, right? This is the lower end where the posterior wall of the rectus sheath ends here. Okay, so this is what we can see. We can see two vessels also entering here into the rectus sheath, and this is the superior epigastric and this is inferior epigastric artery. Coming to contents of the rectus sheath, let us look at the contents. So there will be muscles, there will be vessels, and there will be nerves. So let us start with the muscles. We already know that the two muscles that will be enclosed in the rectus sheath, obviously they will be rectus abdominis, and the small muscle, if it is present, then the pyramidalis. Which blood vessels? That also we have already seen. The superior epigastric vessels, artery and vein, and here you can see inferior epigastric vessels. The superior epigastric artery, that is a branch of internal thoracic artery, right? Its terminal branch, and inferior epigastric artery, that is a branch of external iliac artery. Nerves. Nerves we can see here, these will be the terminal parts of the lower 5 intercostal nerves, right? So from 7th, 8th, 9th, 10th, which will be around the umbilicus, it will supply the skin around the umbilicus. It will also supply all these anterolateral wall of abdomen, their muscles of the anterolateral wall of the abdomen. All these will be also supplied by these nerves. And then we have the 11th intercostal nerve. We also have this subcostal nerve, which you can see here, which is going to supply the pyramidalis muscle here. So these are the contents of the rectus sheath. Coming to applied anatomy now. So what is the anatomical basis of giving abdominal incision, right? So we will consider only few which are related to the rectus sheath here. So a midline incision can be given, right? It can be made through the linea alba. And why it is preferred? Because it provides a bloodless region here along which the abdomen can be open and you can reach the abdominal contents here. But it has a disadvantage also. What is the disadvantage? That it leads to post-operative weakness and herniation may occur. Why? Because it is avascular region there. Therefore, the healing also is going to take a lot of time and it will not be proper. So this will be the disadvantage. The other incision that can be given to reach the abdominal contents, that is paramedian. So you can see here, this is parallel to the median plane. This is be given in the region of the anterior wall of the rectus sheath here. So you can see incision is placed 1 to 1.5 inch lateral and parallel to the midline. So what happens here is the anterior wall of the rectus sheath will be opened, and next thing where the care has to be taken is that the rectus abdominis muscle, that has to be retracted laterally and never ever medially. It has to be retracted laterally. Why is it so? Because what happens is rectus abdominis muscle, if it is retracted laterally, then you avoid injury to the intercostal nerves that pierce the sheath laterally. So here you can see this is the rectus sheath here, this is rectus abdominis muscle, and here you give the incision and you retract this muscle laterally. What will happen if you pull it medially? You may injure this intercostal nerve which enters the rectus sheath from the lateral aspect. So this care must be taken. So that's all for this video. Thanks for watching, and if you have not subscribed, please subscribe my channel so that I can put more such videos. And if you want the questions and answers in anatomy, all types of that, then visit the website, that is anatomyqa.com. Thanks once again.